Did you know some gallstones can grow as large as a hockey ball? But you might not feel a thing. Size doesn't always equal symptoms. In fact, many people walk around with large gallstones for years and never know it. With gallstones, whether they're big or small, innumerable or single, the only question to answer is, are they causing symptoms? If the answer is yes, or most likely yes, then those gallstones need to be considered for removal with a cholecystectomy. Hi, my name is Dr. Andy Gray, and I'm a general and HPB surgeon working in Melbourne, Australia, and today I'm going to talk to you about gallstones. What are gallstones? Have you ever felt a sharp pain in your upper abdomen after eating a greasy meal? It could be gallstones. These are small, solid deposits, kind of like pebbles, that form in your gallbladder, which is a tiny organ located below the right ribs, just below your liver. The gallbladder normally stores bile, which is produced in the liver and helps your body digest fat when released into the digestive system. The concentration of ingredients in bile, such as cholesterol or bile salts, is of critical importance, and sometimes imbalances occur that leads to crystallization, which simply means some tiny particles of the bile ingredients are no longer maintained in the fluid state. The mixture of these crystals with mucus from the gallbladder wall can eventually lead to the formation of gallstones. How do they present? So, how do you know if you have gallstones? For some people, they don't know at all. These are called silent gallstones and are often found by accident during a scan for another reason. When gallstones do cause symptoms, the typical presentation is called biliary colic, which describes a sudden, sharp pain in the upper abdomen, normally focused under the right ribs and sometimes radiating into the back. It can last from a few minutes to a few hours and often starts after eating a meal, particularly one with a higher fat content. Some people also feel nauseated, bloated, or might even vomit. Importantly, once the episode of pain resolves, either independently or with analgesia, there is an extended period of time, perhaps weeks, months, or years, before another similar episode occurs. For some people, maybe because their pain occurs more in the chest, initial investigations might focus on the heart. Other times, because of the pain presenting more centrally in the abdomen, the pain might be diagnosed as coming from an inflamed stomach or reflux. Either way, if initial investigations or treatments don't resolve the issue, considering gallstones as the cause could resolve the diagnosis. How are gallstones diagnosed? The gold standard diagnostic tool for gallstones is an abdominal ultrasound. Sometimes gallstones might show on an abdominal CT scan, though more than 85% of the time they will not, meaning performing a CT preferentially compared to an ultrasound when considering a gallstone diagnosis can give a false impression that gallstones are not the cause for a patient's symptoms. What complications can occur from gallstones? The most common complication is something called cholecystitis. That's when a stone blocks the outflow of bile from the gallbladder and causes it to get swollen and inflamed. It can be really painful, and the pain usually doesn't go away on its own, unlike typical biliary colic. You might also get a fever or chills, and if it's not treated quickly, the gallbladder can get infected, which is a more serious situation. Most of the time, the persistent pain from cholecystitis will lead to a patient presenting to emergency. In some cases, the gallstones can block the bile duct, which is the small tube that carries bile from the liver and gallbladder into your digestive system. This can cause a backup of bile in the liver, which leads to jaundice, where your skin or eyes turn yellow. It's a warning sign that something is seriously wrong, as bile duct blockage can lead to a bile duct infection that can quickly lead to sepsis. Should any patient develop pain and jaundice, then this warrants immediate presentation to emergency. Finally, if a stone blocks the pancreas duct, which also connects to the bile duct, it can trigger pancreatitis, which is most often a very painful condition where the pancreas becomes inflamed, predominantly due to the digestive fluid of the pancreas leaking into the organ itself. This is also considered a medical emergency, and whilst most people who develop pancreatitis from gallstones make a swift and complete recovery, others spend months in hospital and are left with lifelong issues including diabetes and malnutrition. What are the treatment options? The gold standard treatment for the management of gallstones is a cholecystectomy, which means the surgical removal of the entire gallbladder organ along with the gallstones trapped inside. In Australia, the vast majority of gallbladder surgery is undertaken using the minimally invasive laparoscopic approach. Should you be diagnosed with gallstones after an episode of biliary colic, then it is likely this surgery will be booked for you electively on a planned date. Should you present to emergency with cholecystitis, or with any other of the complications mentioned, it is likely your surgery will be completed urgently as an inpatient. Most of the time in Australia, this will still mean the gallbladder is removed laparoscopically, though there is a higher risk of complications, including needing an open operation, when an urgent gallbladder operation is required. Additionally, when gallstones are also diagnosed in the bile duct, other adjuncts to the removal of the gallbladder alone may be required. This is because a standard cholecystectomy does not address stones that have escaped from the gallbladder into the bile duct. These adjuncts include an ERCP, which is an endoscopic procedure that normally is completed separate to the gallbladder removal, or a bile duct exploration, which requires additional surgical training but can be completed at the time of the gallbladder removal.